Responsibilities of the Xray Supervisor. Definition of supervision is responsibility for and control of quality, radiation safety, and technical aspects of all X-ray examinations and procedures. The chief radiologists or their designees, meaning other radiologists and/or physicists, are responsible for ensuring that fluoroscopic equipment under their jurisdiction is used safely and effectively. In establishing a procedures manual for the use of fluoroscopic equipment, they shall be guided by the ALARA principle. Licentiates, meaning physicians, who may use and supervise the use of fluoroscopic and ancillary equipment, must be holders of current and valid radiology supervisor and operator certificates. Credentials may be validated on the RHB website. Regarding the use of fluoroscopy equipment by holders of technologist fluoroscopy permits, diagnostic radiologic technologists who hold current and valid technologist fluoroscopy permits may use fluoroscopy equipment under the supervision of a licentiate, as just described. As a real-life example of this, in a previous job, I was asked to operate a C-arm for a surgeon performing an ORIF, open reduction internal fixation, of a foot. This surgeon, operating in the state of California, did not possess a supervisor and operator permit. In this scenario, I had previously been made aware of his frequent requests for a C-arm, so I had to inform him of his options, which were very few. He could order plain film X-ray views during surgery, where the technologist would take non-fluoroscopic portable X-ray machine into the OR, and he would need to wait for the CR images at that time to be developed. Option 2 required a physician to enter the room who had a current and valid supervisor and operator permit for the duration of the surgical portion requiring C-arm guidance. Or option 3, which he didn't like at all, was to simply not use imaging guidance for his surgical procedure. Luckily, he was able to find another surgeon with a supervisor and operator permit to be present. Supervisors and operators, as well as technologists who hold fluoroscopy permits, are required to prominently display a copy of their certification document at every facility where they use fluoroscopic equipment. This can be the actual certificate itself, or a copy if you have more than one employer. It can also be printed on a list with each holder's full name, certificate number, and expiration date listed, which takes up far less wall space if you work in a larger imaging department. It should be noted, however, that whichever way your department posts these, it's important for someone to update it regularly to ensure unexpired certificates are not on display. You should also avoid having certificates posted for employees who have since left the organization, and to keep them current enough so that new employee certificates are visible. You might be asking yourself, why do I need to know all this? I can assure you it's a basic expectation. Yes, it will most likely be the responsibility of someone in leadership to acquire these and keep their display current, but there are times when an accrediting organization may ask you about them. The last CMS inspection I experienced in California, I was asked about these very things, in addition to the review of our annual fluoroscopic inspection logs for lead aprons. CMS is the Centers for Medicare and Medicaid Services, and they will schedule routine inspections, but can also randomly inspect a hospital without notice. I can recall an inspector finding the display of certificates and permits issued by the California Radiation Health Branch, and he asked me, "How do you know these are valid?" At first, I simply pointed out the expiration dates on the certificates, but the point he was making was more along the lines of, "How do you know they haven't been suspended?" as he questioned further. Anyone can go to the RHB website and search by certificate number, full name, or last name at the website displayed here. In addition to why do I need to know this questions, I suppose it's only normal that you ask, why should I care? Well, again, being a technologist as opposed to a technician involves being a healthcare professional, meaning you should be up to date on rules and regulations concerning your field and scope of practice. But I'd also like to add this. Regardless of accrediting body, whether it's CMS or the Joint Commission, just two examples of hospital accrediting bodies, failure to comply with their accreditation standards may mean you will be required to correct the unmet standards, or it could mean penalties or fines for your organization. But it could also influence the revenue earned by your facility. If accreditation standards go continuously unmet, you may lose accreditation. Any range of these shortcomings may influence the amount of Medicare and Medicaid reimbursement for examinations and procedures already being performed. That will not only influence your organization's finances, but will ultimately affect your own. As this video is being created, we're seeing more and more federal cuts to Medicare. The reasons are beyond the scope of this presentation, but we should be doing everything within our scope to maintain the highest level of reimbursement for the work we perform.